Hey guys, so this week we read the articles about the mental health care of children. The first question that was listed in the discussion board post was what surprised you most? In the first article, what really surprised me is that they said 15 million children are in need of psychiatric help. I took it upon myself to look up how many kids are currently living in the US right now. And according to the Annie E. Casey Foundation, there's 74.2 million children living in the US. So that puts it right about 20% of kids who need some sort of psychiatric help, which is really shocking to me. Um, they also said that only about 7% of those kids who need the help are getting help, which was also super, super shocking to me. Between the resources that I feel are available, just that people aren't necessarily taking advantage of them, whether it be because of financial reasons or because of um, whatever the case may be, trying to get there wherever the office is located, not finding a correct psychologist. That was very surprising. Um, and then it also mentions that kids from different backgrounds have different baselines on their behavior. And this kind of goes more into an issue that's present in the psychology field right now. Just that a lot of the research that we have done is done on, Western culture, white American children who they take this information and then they put it into these programs that they're using in communities that, might be mostly immigrants or maybe mostly African Americans. And these programs aren't necessarily designed for those communities, so they don't see as much success as they usually would. Um, so all those things were kind of interesting to me that were mentioned in the first article. In the first video clip, the fact that they said that 80% of children need help, which is definitely much higher than the other article mentioned, but it kind of interested me what maybe they got that 80% from. If they observed 80% of kids had some sort of behavioral issue in the classroom, and if that were the case, then yes, they would need help. Or if that's truly they think that 80% of kids need psychiatric help with a therapist or something along those lines. Something else that made me think about that I've never thought about was the main topic of the video, that nurses get a lot of mental health related issues. Definitely when I was in school, I noticed that kids who didn't necessarily do well in the classroom or who were having troubles at home would find themselves in the nurse's office a lot, but it never occurred to me that that definitely is something that nurses see and should be prepared for and should be trained for. In the second audio clip, the fact that the clinical child psychologist who was in the clinic that they set up in the Bronx was not necessarily diagnosing children as mentally ill, but providing changes to the more nurture part of their care. So changing the way that their parents maybe interacted with them or something in their environment was really interesting to me, because I think in the medical field, we see a lot that people are very quick to ask for a diagnosis and they want to put a label on what it is that their child is having issues with. So I think it's really good that she kind of stepped back, and especially with those kids who are still in that plastic phase where there's a lot of change that can still happen, wanted to change the environment rather than changing, putting the child on some sort of medication or putting them in therapy 3 times a week or whatever the case may be, because those things also can be really disrupting. Um, for the second question, does the school have the responsibility to care for children's mental health issues? I think yes, personally. We, as children, spend a fourth to a third of our day at school. And definitely the school should be involved in the care of these children, and they should know the things that they're doing and how that affects the classroom and how it affects child's development. And it's just something that the school needs to be more aware of. So yes, I definitely do think the school has a responsibility in the matter. Something that was mentioned in the book that I also think school is really important with, it says the adjustment problems of child sexual abuse victims, including anxiety, depression, low self-esteem, mistrust of adults, and anger and hostility, are often severe and can persist after abusive episodes. Younger children frequently react with sleep difficulties, loss of appetite, and generalized fearfulness. Those things are definitely things that can be seen in the classroom, or at least the effects of those things. So children who are acting out or have severe anxiety issues are definitely big, flashing signs that there may be something going wrong at home. And for a lot of these kids, they will not see anybody who is not their parents if their parents don't take them to see family or take them to see friends, or they don't have friends in the neighborhood, or, the neighborhood isn't conducive to kids playing outside. So their school becomes this really important place where that's the only exposure they get to adults that are not their parents, or not the family members that may be abusing them, because most abuse does occur in the home. So in that regard, the school does definitely have a responsibility. As for the last question, what can be done? I think that something like wellness surveys would be really helpful. We do something similar in the dorms as I work as a CA. We kind of give them these surveys and ask them in the first couple weeks of school how they're doing, how they're adjusting to classes, how involved they are on campus, if they've made friends, we can help them with as CAs, what we can connect them with on campus, those sort of things. And I think that'd be really helpful for teachers, not only to see where mental health issues may lie, but also just to recognize where they can improve their teaching styles, especially for teachers in their first and second year. It just makes them more aware of what's going on in their classroom and their students' lives. Something else that needs to be done is we need more school psychologists and community programs and school nurses who are trained in mental health issues, just because those things, having a school psychologist on campus once a week, or even having a community program once a month that addresses, behavioral issues or playground etiquette or how to best help your child study or whatever the case may be something that's really helpful for a lot of parents.